This is one of the reports through Johns Hopkins that we provide to our clients each and every day, each and every month. So right on your portal, your broker and us generally work on this together and then advise you guys on what the problems are. But you can pull this report anytime you want. This is a report for Viking Range from a few years back. They've allowed us to use their data. Here's what it's showing you. Out of 909 employees, that represents 1,600 members. Johns Hopkins says 35 of those members are at high risk. They have an average of 6 conditions each as identified through the medical and pharmacy claims. They represent 2.2% of your population. 9 of them, 7 spouses and 2 kids, you do not even know exist. But the problem is that all 35 people are going to average $43,000 a year in claims. You multiply that out, you have 2% of your population generating $1.5 million in claims, which is almost 50% of the total claims risk. So 2% of your people driving 50% of your claims. Round it out to the top 20% right here, and you've got almost 90% of your claims coming from 20% of your people. And that's where health coaching comes in. We target the top 20% of your population for health coaching. We try to engage them in one-on-one dialogues regarding their health. And how do we know what's relevant for the rest of your population? Because ultimately, we do want to target 100% of your people. This is also a grid from Johns Hopkins, and it takes the top 16 diagnosis categories and then lets you break them down in real time and shows you how many people have each condition. 20 people with high blood pressure, 14 people with high cholesterol, 9 type 2 diabetics. Here's Johnny right here. 6.5 times the national average. Cholesterol 4 times. Blood pressure 3.5 times the national average. If you've often wondered what is the key to managing healthcare expenses, first off, you need to have your data. Without it, you have no prayer. Once you've got your data, you just need guidance. You need to figure out what it is that's driving the expenses. Behind the scenes, I can tell you compliance rates on these people. Are they going to see their cardiologist? Is this guy going to see all the doctors he should be seeing, which is a foot doctor, an eye doctor, a primary care physician, an endocrine doctor, lots of people for diabetes. But most people are not compliant. And it's about closing those compliance gaps in an effort to improve the health status and lower claims. When you have lower claims, you spend less on health care when you're self-funded. It's very simple. Now, you may be wondering, how on earth are you going to engage Johnny? I've got an entire organization of Johnny. He doesn't want to talk to me, let alone talk to a nurse after he's worked 12 hours. I couldn't agree more. And that's why in the Affordable Care Act, President Obama has allowed us to use penalties and incentives. These are 2 quick examples. Groups that use exclusively an incentive to the tune of about $500 can expect to see about 33% engagement of their population in a variety of different programs. On the other hand, groups that use a penalty to the tune of about $500 a year can expect to see about a 77% engagement rate. Why such a difference with the same incentive or penalty? Because on this hand, an incentive, you're giving me money I never had. And what's the difference? I never had it. I'm not going to miss anything. Penalty, on the other hand, you're literally taking money out of my pocket. And subconsciously, that does something to employees, and as a result, the engagement rates are higher. The reality is you don't have to do either of these. You don't have to do anything I've talked about today. Self-funding by itself is a smarter way to manage health care. But if you're going to self-fund, managing the risk makes all the sense in the world, because if you can control Johnny's claim, it's a dollar that's never going to leave your bank account, because at the end of the day, you're really only paying for health care that your employees consume. We provide all kinds of resources. So other than, sitting with us and ultimately figuring out what types of programs up front are going to be relevant to your organization and then telling us which ones you like, which ones you don't like, the ongoing management of everything I've talked about today is done between your consultant and WellNet's. We've got all kinds of communication materials for your members, all kinds of digital tools, including a member portal and mobile app. And as I mentioned before, what's very important is the high-touch aspect, which is WellNet's registered nurse health coaches and navigators, which help these members navigate through the wellness program, answer any questions they may have, etc. For you, you get an online portal. So you can see everything that's happening. You can track the wellness programs. You can run these Johns Hopkins predictive reports that I showed you. You can track all of your claims. You can see all kinds of useful information on this portal. It's open and available 24 hours a day as it is web-based. Your members, as I said, have access to a mobile app and everything for them online as well, which makes managing healthcare for all stakeholders a lot simpler than it has been in the past.